New tonight, the CDC is changing its stance on COVID-19 shots.
Yeah, they're now dropping their recommendation for the vaccine, and it's leaving the decision up to regular people.
News 8's Preston Stober joins us now with how experts are reacting. Preston.
Yeah, the switch to individual-based decision-making model is a departure from the CDC's recommendation in previous years that everyone gets the COVID vaccine. A local health professional believes the change is not bad, but he hopes it does not send the wrong message.
Before this year, the CDC recommended these COVID-19 booster shots for every American 6 months and older. That recommendation fully ended on Monday when the CDC announced that every American should make their own decision with the help of a primary care physician. Acting head of the CDC, Jim O'Neill, said of the change, quote, "Informed consent is back." CDC's 2022 blanket recommendation for perpetual COVID-19 boosters deterred healthcare providers from talking about the risks and benefits of vaccination for the individual patient or parent. That changes today, end quote. The CDC adopted this change based on recommendations made by advisors picked by U.S. Health Secretary Robert F. Kennedy Jr.
New people on the panel, and so it's a little bit hard for me to understand, the discussions that were in the room about why to make the change in recommendation.
Dr. Andrew Lynn of Bristol Health is reacting to the CDC's change and recommendation.
A discussion with your primary care provider or healthcare provider is definitely good. What I hope is that it doesn't send the wrong message to folks that the COVID vaccine is dangerous, which it's not.
Dr. Lynn says that there is no new studies suggesting the vaccine is dangerous, nor has the formula for the shot changed.
That's why it's a little bit of a head scratcher as to why they would make this sudden change in recommendation.
Dr. Lynn adds that he hopes people will continue to choose vaccination when it is safe for them. CDC numbers show that in the last full week of September, 6.7% of all COVID tests were positive, as 0.7% of all U.S. ED visits were diagnosed as COVID. The week of September 20th, 0.8% of all deaths in the U.S. were at the hands of COVID-19.
Now, Dr. Lynn did tell me that he thinks the CDC may not stop here and they may change their recommendations for other vaccines as well. That'd be such as the flu shot. In studio, Preston Stober, News 8.